We did a bait and switch on you, Jason. We're actually going to just talk about your music career, and that's a whole episode today.
Good. It's going to be super short, but it'll be fun nonetheless.
Jason Burum has over 20 years of experience leading and deploying cloud-based digital health and collaborative clinical enterprise workflow solutions. He is currently the Vice President of Patient Engagement for Clinical Effectiveness at Wolters Kluwer, where he oversees all facets of the patient engagement business. Before joining Wolters Kluwer, Jason held multiple leadership roles, including VP of Sales, Business Development, and Marketing at RMDY Health, a provider of digital therapeutics, SaaS solutions, and Chief Commercial Officer at Healthwise, a provider of patient education for health systems and payers, where he ran sales, marketing, and product strategy for over 13 years. Jason holds a BBA in Business Marketing and Management from the University of Portland, and if you couldn't tell already, is passionate about helping define corporate strategies that yield aggressive and sustainable growth for digital health. Jason, welcome to the show.
Welcome, Jason.
Hey, thanks. Happy to be here.
Amazing. So, Jason, you've had, one of the most prolific careers in digital health out of all the guests that we've had on the show. You've been in patient engagement in this space for the past 2 decades now. And so I think our listeners could appreciate all of the history and insights that you've had on the patient education space and patient engagement space. So maybe to start the conversation, you first worked at WebMD almost 20 years ago now. So I'm curious, what was health education like back then?
Yeah, totally. And I'm feeling old now. And it's funny to think about, I don't even know if digital health was a phrase in the late 90s when I was part of a startup, a digital health startup that was acquired by WebMD. But it's interesting that at that time, a lot of the challenges that we were like, there's a ton of consistencies actually. There are a ton of things that are still challenges that were challenges at that time. And then there are a slew of opportunities that exist now that you just couldn't even fathom at that time. So it's kind of an interesting paradox. But I think collectively, everybody who worked on that project that was called WellMed, that was acquired by WebMD and kind of formed the WebMD Health Solutions Group, I think that a lot of the ideas that supported that effort were really ahead of their time. And I think, where we are today is actually trying to tackle some of the challenges that we had really started to try and address back in those days. Like, hey, can't the health record actually be owned by the patient? And can it actually transport itself around from entity to entity and kind of just live with the patient forever and be under their control? And can't they control who accesses their record and decide, which systems are gonna access their record to be used to drive a better healthcare experience for them? And hey, shouldn't we have a baseline? Shouldn't we check in with patients and health consumers and establish a baseline of their health status before we just try fixing things that we don't know exactly what we're trying to fix? So let's do a basic assessment and see what the baseline of their health is. So a lot of those concepts are still super apropos, super important for us to continue to tackle today. But that's kind of how it started. I think the biggest change is the fact that in those days, the idea of having a cloud-based software as a service type solution was super radical, really radical. Like, what? It's going to live in the cloud? What is that? In fact, I don't even know if we called it the cloud at that time. So in any event, obviously that's radically different. Now we know a lot more and we know what the benefits are. So yeah, interesting change from those times.
And Jason,
now I've really dated myself for the whole entire rest of the discussion. It's like I'm the old guy that we're talking to about digital health. So,
Jason, I guess the sad, funny thing is all those questions that you brought up around, can't the record follow the patient? Can't we check in on patients digitally? As much as we were asking those questions back then, the sad thing is that we're still asking a lot of those same questions today. For better or for worse. So we've definitely gotten better. We haven't quite gotten all the way there yet. I'm sure you'd agree with that. I was wondering, just again, going back to the WebMD days. So, I think when most people think of WebMD, they think about, that collection of information on WebMD, website and all that content. And patients finding that information themselves, again, for better or for worse. But back then, was there, before you got to Healthwise, was there a lot of activity around sending education to patients electronically back then? Or was it mostly about still patients doing self-discovery to find that kind of content?
Yeah, it was both. I mean, it was really, and I'm not saying we were, or the market was ready to accept both, but I think there was at least an attempt to try and do that. And we ran into a lot of the practical challenges of, hey, in a complicated technology ecosystem, how do you get more prescriptive with a recommendations engine? I mean, Amazon was tackling the same thing in a different industry, but it's like, how do you recommend what content or what experience you should introduce to a health consumer based upon some understanding of their health status? And we were, like I said, how effective we collectively were, there's going to be a lot of opinions about that, but the goal is for at least as often as we're providing a good resource for health consumers to self-discover resources they need to answer their questions for themselves or their family, we were also trying to make recommendations. And we would do that basically through providing some sort of assessment. And there were a ton of practical challenges around that, like how do you crosswalk between medical terminologies and consumer terminologies, and those concepts hadn't really been tackled. So like, how do you have a consumer health terminology thesaurus that crosswalks to ICD-9 at the time was or SNOMED, which ended up being a nice backbone and crosswalk to do that. But those are all the kind of things that you had to tackle before you could start making good recommendations, especially if you were trying to rely on a clinical information source to personalize that experience. So,
yeah.
So I guess, Jason, after WebMD, you went to Healthwise. You were there for 13 years and really kind of moved up through the organization. What was the Healthwise product suite around patient education like back in 2003, and then how much had it changed by the time you kind of moved on in 2017?
Yeah, so so it was such an interesting journey. Really, really cool work by a lot of awesome people. So a lot of what I'm going to say is it was always a team effort, but I think, the challenge was in that time frame. This was back in 2003 to 2005 time frame. Is we're still in this realm where WebMD is kind of becoming the household name for consumer health education, and they're aggregating content sources, right? So there was obviously a challenge in that there are a lot of information sources that you probably as a health consumer shouldn't trust completely. Very analogous with a lot of what we find today, I'm sure, if you're a health consumer that doesn't have the same access to evidence-based sources that probably this group of people has access to. But one of our challenges is how can we be a go-to resource to move forward the mission of making sure that consumers have access to the best information so they can make the best decisions for themselves and their family. And so at that time, the products were essentially a book, literally a book, which in this world of digital health is kind of like such such an ancient thing to think about. But really, a lot of the business for Healthwise was in self-care guides. So this was and the founder and CEO of Healthwise for so many years, Don Kemper, really kind of modeled it after the Dr. Spock's book for parents about kids, like kind of what to expect when you're expecting, but the Dr. Spock version. And so we had a self-care guide book that drove a lot of the distribution, a lot of the revenue. And then there was also the concept of an online health library, a collection of online health information. And obviously that was pretty new from a revenue perspective, from a number of people who are actually licensing access to that as a resource. That was all new. And over time, we were able to kind of switch the business and actually go through a transformation where the print portion of the business, which was really the focus, was transitioned out. I mean, we were really sunset that product and said, there are better ways to get in front of health consumers. And then we kind of marched along on the back of this online health library. And then we started to grow derivatives that really allowed the education that we knew was so critical to support patients. We knew it had to be integrated into workflow. And so that kind of it kicked off this huge innovation effort to go take the content that we'd already created, create some new content, and make sure it's in a format that not only supports the type of discussions that clinicians need to have with their patients, but also is surrounded by the right technology wrapper so it can be ingested into workflows and can be made available to clinicians and patients at just the moment that they need it to make the best decision. So that was a huge transformation. And then kind of the rest is history, because we were benefited. Fortunately, we weren't the only organization that was thinking about how to embed the best patient-facing decision tools into workflow. There was also this little act known as the Accountable Care Act in 2010, and a lot of funding went into making the record electronic. And of course, there's a patient aspect to all of that. So that was a huge opportunity and a wake that we were able to surf in order to get patients the tools that they needed to be successful right as a part of that conversation with their doctor. So
one thing that struck me in some of the research that I did on you, Jason, was how you define shared decision making. What you're saying is it's more of a process than a tool. And I really appreciate that. And I'm curious why you view it as a process over a tool.
Yeah, I mean, good question. So, I mean, I think, it's best to think about it in terms of the way that each of us go about making decisions. And if you pause and think about it, a lot of studies show that decisions are based upon primarily emotion, and then we tend to use facts to justify, and then we may rinse and repeat. And so the reality is kind of the way that we all go about making decisions every single day tends to go through that cycle and kind of repeat itself until we land on something that we feel is satisfying. And sometimes it's super well informed. Optimally, it's super well informed. And sometimes it remains at kind of that surface level where it just feels like it's the right thing to do. And sometimes some types of decisions in our lives, totally fine. But other types of decisions in our lives that are pretty invasive can be invasive and kind of like hugely impact your quality of life from here moving forward forever. That's where we have to understand that pausing and taking a moment and focusing on the actual process of landing on the right decision for you and your family is a really important thing to do. So this whole concept of shared decision making, I'm certainly not the expert, and I certainly didn't start it, but felt like I had a unique seat at the table to kind of view and then also help shape the way that a lot of shared decision-making solutions kind of made their way into the marketplace. The important thing to consider is just like other decision support offerings in other markets. Like if you think about for a certain segment of consumers out there, thinking about buying one dishwasher over another or a home appliance or a car, first thing they'll do is go look at consumer reports. So they'll say, I'm not an expert on these things. Like I want an expert who's like, gone into the details and is able to practically regurgitate a really easy to understand kind of breakdown of the pros and cons. And so, that same type of process of taking really complex material, distilling it down to something very simple, hopefully very elegant, putting it into a format that allows you as a non-expert to kind of weigh in on really possibly complex concepts and understand what your risks and benefits are in a very clean way. It's really, really important. And then it's really important in healthcare to make sure that you're doing that in partnership with your healthcare provider. So I think there are lots of opportunities where shared decision-making can happen asynchronous, meaning, the ball's in your court, you work on it as the patient for a while, then the ball's back in my court as a provider, and I can give you some expert guidance, and then we can cycle through it again. There are other times when you've got to have that dialogue going, and it's real-time engagement that needs to be supported. both of those things need to be supported, but can always benefit from an evidence-based approach who's kind of taken a look and said that, hey, if somebody's got low back pain and they need to be able to find a path through to improve their quality of life and improve their health status, the evidence says after 5 years, whether you go a more invasive procedure or whether you go physical therapy or another type of treatment path, you can have exactly the same outcome. So then it really is just a function of what's best for me as a patient, like literally what is the experience I want to have and what risk am I willing to take on. And that whole element of healthcare is super important to putting us in the best position for patients to participate in getting to the triple, the quadruple aim, whatever number of aims that we all want to agree on. But it's an important element to any patient engagement approach.
Right.
So Jason, one of the things that I noticed was that I believe Washington State is kind of the only state that has some sort of requirement for certain contracts with the healthcare authority around incorporating shared decision making and patient decision aids into the patient journey. But I don't believe any other state has actually gone ahead and been as progressive on that. I was curious if you had any sense of, as important as shared decision making is, and you've established that really well today, why haven't most of the other states kind of been more progressive on not necessarily maybe mandating it or sort of mandating it to really make it part of the culture of patient engagement?
I don't know. It's I've always been surprised. I've always been surprised that it isn't an easier mantle for more industry leaders and experts to kind of take on. I think there's a couple of things that I would say contribute to that. One is there's a belief that it's already being done. I think if you go talk to, when I've spoken with physicians, they're certainly not saying I don't do a good job of helping my patients understand the risks and benefits of a treatment path that I'm chatting with them about. I mean, I think if you ask professionals, healthcare professionals and doctors, I feel like they think they're doing a really good job of helping patients do that. So it's one of those problems that's hard to recognize. And I also think that it may be superseded by a more foundational problem, which is one of my industry colleagues who focuses on behavioral science, and she would always say, hey, for the first time in human history, the health of our populations are failing more often because of bad decisions than because of infectious disease. And even in the context of global pandemic, that's still the case, right? So we still have, fundamentally, it's a behavior change problem, which is more fundamental and more important to tackle than perhaps the shared decision problem around which treatment path to take. So I think it's a function of two things. One is there's a belief that most of the time it's already being handled as a part of the clinician-patient relationship. And two is it may not be that that's the biggest problem we need to tackle right now, in as high priority a way as other problems, such as just as health consumers, we make bad decisions too often, and too often aren't good at fixing our trajectory to where that bad decision is taking us. So.
And actually, Jason, that segues really nicely into digital patient engagement. How do you think about digital patient engagement insofar as a behavior change or to promote behavior change and to help patients make informed decisions?
Yeah, I mean, I think core to a lot of the work that you guys are doing, core to a lot of work that a lot of us are doing, especially in digital health, is as consumers across every industry, we're blown away by the level of sophistication that new tools have allowed us to kind of take way more control over all kinds of different aspects of our life. And I think, the promise of benefiting from digital health experiences and tools, even though it's important in other industries and other domains, it's never been more important than it is in health. We already know this, right? We know it to be true that if our health status, if we have a problem with our health, like very few other things are going well if we're building on a foundation of our health not doing well. So the other thing is so it's really important. And I think the second thing is that healthcare is really complex, right? So this is one of those situations where, like, I'll date myself again. There's that Seinfeld episode where they park in the parking garage and they can't find their way back. They didn't remember where they parked, and it was a complex multi-level parking garage. And you got these segments of the episode where they're like following the story of each character trying to find their way back to the car and running into these ridiculous situations. And it's like, healthcare can be that way. Healthcare can be like, I parked my car somewhere, I don't remember where. It's a super complex environment. I'm running into all of these challenges, just simply trying to do the basic thing of finding my car and moving on with my day. And if you've got if you have a tour guide, a wayfinder, an expert that's like in your pocket, like on your device, and just it's there for you, it knows about you, it's connected, really, this is really important, but it's connected to what your care team, a team of experts, has asked for you to do, or a plan of care that they would prefer that you focus on as a priority. And it can also take in information like how many steps you've walked today, or how you're doing against closing your ring on an exercise routine. We've never had an opportunity like we have right now to present consumers with the ability to really take control over what is an immensely complex system and industry that they're engaging with from time to time, and really allow them to kind of drive what is my priority, what do I want to focus on, and do it in a way, especially with digital health. The coolest part of the promise is, let's do it in a way that not only is meaningful for health consumers and patients, but is absolutely aligned with the objectives of the healthcare industry, like better quality at a better cost, better experience, better situation for healthcare workers that are already overstressed and really need to lean on digital tools to automate the way that they can engage and have a bigger impact on more than just one patient at a time. Who doesn't want to do that? Who doesn't want that multiplier effect of being able to impact, dozens, hundreds, thousands, tens of thousands of patients to their benefit all at one time? And digital health, we can do that. And so it's immensely important. Yeah.
So Jason, on that note, I mean, after Healthwise, a couple of years ago, you moved on to Wolters Kluwer. Now you're leading, patient engagement and Emmi and so forth over there. What innovations or solutions is your team working on that you've been most excited about recently?
Yeah, I think, number one, it's really important to make sure that we're taking care of the patient education and engagement hygiene, the hygiene of the industry. Let's just make sure, like, it should be in place, but let's just make sure. Does everybody have a really great source of patient education that is integrated into workflow, that is really helping to close that knowledge gap between the care team and the patient, so the patient knows how to care for themselves, when to call for help, all that kind of stuff? Let's just make sure that's in place. Let's make sure that that's in place and being supplied by not Dr. Google. No offense to Google, I love what they're doing in the healthcare industry, but we know that they're aggregating a lot of sources, and not all of those sources are evidence-based and connected with the same clinical decision support tools that their clinicians use. So let's just make sure that we're doing the best we can at that most foundational level. I think step two is, let's make sure that when we are engaging patients, that we are in the best position to track whether or not, together with a patient, like, hey, are we making progress? And we can report that back to the patient. We can report that back to the care team. Are we making progress together? Or is it helping the patient have a better experience? Is their health status improving? And that's really missing in a lot of patient-facing solutions, is there's this huge, like, hey, we intrinsically know this is the right thing to do. How can you say no to educating a population about something that's really important? Okay, I get it. But are we actually measuring, and how do you know that we're making an impact if we don't measure it? So we need to make that whole patient engagement experience, including kind of like tracking to an outcome that a patient wants and the care team wants. That's got to be in place. And then then really where we innovate from there, and I think that's just like table stakes. You got to do that stuff in order to be in the equation. And then where we go from there is all about personalization. I mean, this is not, healthcare is, as much as we hear about the opportunity to advance medication therapies and kind of focus on precision medicine and benefiting from deeper insights into each one of us so that the treatment option that we're presented with is fine-tuned exactly down to our DNA. It's the same opportunity with patient engagement and consumer health engagement. Is there are a ton of great data sources that health consumers will opt into sharing if they know that there is a big benefit for them in return, so that when they go into any experience where they are touching the healthcare system, if that experience is personalized to their needs, to their health status, and takes into consideration more than just the encounter that they're having right now with the healthcare system, but takes into consideration, step 2, step 3, a longitudinal journey that they're on right now, and synchronizes really well with that clinical plan of care, that's where the future is, right? That's the work that I think, quite frankly, we're all doing together, is how do we, personalize the experience, make sure it addresses the needs of patients over time and takes into consideration their unique needs. And the last piece I'd layer in there is really benefits from data science. There's so much talk around artificial intelligence and machine learning, and it can be a little overbearing, but the reality is we really can improve the moment in time that we reach out to engage a patient and kind of tap them on the shoulder and say, hey, it'd be really great if you have time to spend a couple of minutes on this. The fact that we can engage them at a time that works best for them, and that maybe an AI model can help us with that, because we know how folks of this demographic and health status and geography, we know what engagement time zones are going to work best for them. We know what engagement modalities, what communication channel should we use to engage them, and let them choose that communication channel. So I think using data science to kind of optimize the experience, and then both from a way that we communicate as well as the types of materials that we present, so that they can opt into that choose your own adventure future that we want, where we can say, this doesn't apply to me. Let's just take this out of my experience. Because how many times in healthcare right now are we dealing with things that just don't apply to us, but we have to do it because it's just part of some process. And I think, where we need to go in the future is, and we're doing it right now, collectively, you guys are doing it, we're doing it. We're working on changing the dynamics and the paradigm to benefit from data and insights that help us create a better, more engaging experience. So that's where we're going.
Mm-hmm. And Jason, I guess probably one of the best examples of that recently for yourself and for Wolters Kluwer is that exciting announcement that you had in terms of your partnership between Emmi and Amazon Alexa. Can you tell us maybe a bit more about kind of where the inspiration for that partnership came from, and anything you can share about how that's going?
Yeah. I mean, I think we really benefit from disruptive forces, and I think if we rely as an industry, if we rely only on the innovation and the ideas that we can hatch from inside of our own industry, we're not going to move forward as quickly as we can. If we have wake up calls by disruptive entrants into the marketplace, like an Amazon or like a Microsoft or a Salesforce or an Apple or a Google, like these are all opportunities for the industry to embrace new paradigms, new frameworks. And one of the things that we found really, really exciting is when Amazon launched their HIPAA-eligible skill on their voice platform, their Alexa voice platform. Amazing opportunity, because number one, you just got to respect the fact that when one of those types of organizations that can feel very disruptive, but when they put their money where their mouth is and they say, hey, I want to play in this space and I'm going to do it the right way, and I'm going to make sure it's HIPAA-compliant. I'm going to make sure it's protecting privacy, data, and security in the way that we all need to do for the benefit of ourselves as patients in the system from time to time. When you see them make that type of investment, and then you think about the opportunity around voice user engagement, already, 60, 70% of Americans are using voice as their only user interface for certain types of activities all throughout the day. And you think about the opportunity to engage somebody using that interface, and what happens if you don't make that communication method available? Does that mean you just have zero success because they just didn't have time, or they just chose not to engage with you because you didn't have that option available? Once you put that calculus together, it became really important for us to figure out a way to make that work. And so we were really excited that in some of our more innovative health journey spaces of our solution, we were able to allow for consumers to engage with our program using the Alexa skill Miami Care Plan, and engage and keep themselves up to date on their path, as well as communicate that experience back to their care team. So literally, a patient can update via Alexa, an Alexa device. They can update the program on how they're feeling and whether or not they're having some challenges or struggles, and that information. And they're aware, the patient's aware of this. They're fully on board with this, but that information can be shared back with their doctor, and their doctor can be in a better position to engage them when they actually need help, instead of waiting for the next regular check-in. So, incredible opportunity to improve efficiency, to improve patient centeredness, and just to kind of meet people where they are. Like this is a spot where we can engage. So let's make that opportunity available.
And so Jason, I know obviously when COVID hit in 2020, that changed things for lots of organizations, looking to help patients and providers. I know certainly we saw how Wolters Kluwer and Emmi did a great job, really like open sourcing and making your COVID-19 education and materials available to all kinds of partners and providers and all that, which is fantastic. I was curious if the pandemic ended up changing the product roadmap for Wolters Kluwer and Emmi and patient engagement in general. They're going into 2021. I'm going to guess probably it did, but I'm curious to know if there are any material changes that you can share about how you're thinking about things now that maybe you weren't planning to do this year.
Yeah. I mean, I think right on, and I think it probably did for all of us. I think a couple of ways that I think about it. One is we know that just at the fundamental level, the need to produce quality content that's based upon evidence that's changing super quickly, and getting it out as quickly as possible, and kind of removing all hurdles to making sure that the public can benefit from content creation that's related to COVID, that supports making good decisions about COVID, that educates patients about, especially in a time when information is variable. I think that's where, from my perspective, we really benefit from being completely aligned with an incredible resource like UpToDate, and the incredible kind of huge team of experts that are contributing new information to that resource every single day. And of course, from our perspective, producing content that patients need that answers their most important questions, especially during a time of great uncertainty, super important. It's just not only is it the right thing to do, it's part of our company mission, but it was something we were really excited to be able to support. So at the content level, it absolutely has changed how we prioritize what we're working on, just from that alone. I think in addition to that, I would say that just the explosion of virtual care, kind of the volume of digital health interactions that are happening now as a direct result of the way that the world is different for all of us in the way that we go about our day-to-day activities. I think as an industry, we are in a situation to embrace and accelerate a movement that we already know was the right thing to do, but for whatever reason, the pace of increasing the number of virtual care encounters, or the pace of investing more in digital health, was at the level it was. But now all of a sudden we realize, as a practical reality, we need to double, triple, quadruple the pace by which we support those types of engagement opportunities, and the way that we deliver real good care for patients. And so for us, that's absolutely modified the way that we think about and prioritize our innovation efforts. And there's this huge opportunity now that virtual care is happening, and the difference between what a patient experience in a virtual care format versus what they experience in an in-person format, and the extra opportunities that we have to improve the experience for the patient that benefits everybody in the equation is certainly top of mind for us. And lots of great projects going on with clients along those lines.
I think it's interesting as well, Jason, you're talking about this equation between patients and providers, and kind of fitting in with that equation. I think we all agree one of the biggest untapped resources in healthcare is that patient, is understanding the patient, measuring the data like you suggested earlier. I think maybe just to take a bit of a step back, how do you define patient engagement? What is patient engagement in your eyes?
Yeah, good one. I think it's unnecessarily complicated. It's actually super simple. I think we make much ado and we get confused and defocused too often. But I think honestly, for you and I as patients, if we're engaged with the care team, with the expert resources that we're accessing, if we're just as engaged as they are or more in improving our own health status, we're doing something right in terms of patient engagement. So lots of proxy measures that we can use to show that we're making good progress. We can say, hey, we reached out to a patient, we tapped them on the shoulder, and they responded. That's one type of engagement. A deeper level of engagement may be something along the lines of, they responded and they actually took us up on a call to action to do something about it. Maybe that's an even more important measure. Then as a result of taking us up on that call to action, they either scheduled a virtual care encounter, or they filled a script, or they went in for a test or some other activity. We can measure that. That's a form of patient engagement. And then I think, in follow up to that is, did we see an improvement in health status? That one's harder to track. It's probably the most important, right? Is probably to say that if, the ability to track progress at each of those engagement opportunities, it's the sum total of that is patient engagement. And I think we absolutely miss the mark oftentimes when we're setting up these projects, where we're just not carrying it all the way through to see whether or not there's data that shows that we've made the impact we were trying to make. So I think we have an opportunity as a group of people focused on this space to improve there. But I think the definition is not super complicated. I'm bugging you. Are you paying attention? So
yeah, definitely keep it simple. Actually, that kind of reminds me, you had a mantra in the past. I think this was when you were at Healthwise, but maybe you've carried the same mantra forward as well at Wolters Kluwer. But you always used to say, keep it plain, keep it personal, and keep it possible. How does that mantra fit in with patient engagement in general? How do you kind of view that today?
So many threads that you can pull from that little phrase. I think we could probably pick that apart, but I think not only is it fantastic because we've got some really good alliteration going on with the P's there. I mean, come on, that's fantastic. But I think, if you're going to engage health consumers or really consumers in any industry, you have to meet them where they are. It has a lot to do with health literacy. It has a lot to do with the way that you're translating complex things and making it simple and elegant for the ultimate end user here, which is the patient. They're like you shared earlier that, and I wasn't the person who coined this, obviously, but greatest untapped resource in healthcare being the patient. It's a mantra for many organizations. But I think the ability to meet people where they are and help guide them from point A to point B. A lot of plain language and keeping it simple and elegant is boiled down there. Keeping it personal is all about where we need to go as an industry. It has to be personal to me. It can't be personal. Like the level of personalization that we have right now is I may be a patient with diabetes. Like that's not personal enough, not even close. You need, maybe I am, but I'm a lot of other things. And even if you look at me as somebody I don't have diabetes, but if you look at me as somebody who has a health condition, there are lots of different ranges where I may reside in the trajectory of that health condition. And as somebody who's going to help that person, I need to know where somebody is in their journey and personalize the experience for them. So I can kind of meet them where they are, pick them up where they are, and take them to the next point. That's really the last P, possible. That's possible for them. And it's all about framing things with hope. And for me, this is kind of a personal thing. We have two boys at university. Our youngest, Nick, was actually born 3 months premature. He spent 95 days in the neonatal intensive care unit. And, at that time, as a caregiver for a patient, I was being hit with a lot of statistics. Hey, X% that his brain isn't going to fully develop, X% that his lungs aren't going to fully develop, X% that he, may not make it the next few weeks. Really hard. This is hard stuff. And if you're not offering, and let me just say that, we're all patients from time to time, but we shouldn't be colored by that brush 100% of the time. At our core, we're people. In the healthcare industry, we're health consumers. And when our health status needs improvement, we become a patient. And oftentimes when you apply the patient label, there is a stigma that goes along with that says something's wrong. And it's hard to feel hopeful in an environment where you're labeled with something that means something's wrong with you. So I think this whole combination of keep it plain, meet people where they are, personalize, make it about them, and constantly speak from a position of hope and a belief that the path forward is possible. And let's make sure we're doing the best we can to remove all the obstacles is what that's all about. You probably meant that to be a real simple answer, but it wasn't. So.
That's awesome. And I'm sure there's so much more behind all that as well. So, that simplified version that you shared right there is awesome, actually. I'm curious now, so we're moving more towards this value-based care system, and you've mentioned it already around, fee for value and the quality that we're providing for our patients when they are labeled as a patient in that circumstance. One challenge that presents itself as we shift to this new care model is that there are some providers that are either content with the status quo or they're a little bit slower at moving towards this new reimbursement model. So I'm curious how you've personally overcome some of these challenges when you're speaking with providers, or if it is really a simple matter of fact that you suggested earlier where they just aren't aware of where they are right now and maybe it's your job to educate them. I'm curious your thoughts on that.
Yeah, I mean, I think I feel like it's almost a similar challenge, when you think about tackling the engagement of health consumers, is engaging the professional community. It's almost a similar kind of challenge, and I think the best approach is to one, fundamentally believe that everybody in the equation is trying to do the right thing. There are no devils in the system. The system itself may be complicated. The system itself may include processes that make it hard to prioritize people over the process. But every individual contributor, my take, others could disagree, is that everybody's trying to do their best and everybody's trying to do the right thing. And if you're in the healthcare industry, you're trying to improve the health of your patients and the health consumers that are in your charge. So then it's a function of, okay, we've covered that hurdle. Then it's a function of, can we introduce opportunities whereby doing the right thing actually produces something beneficial that drives the motors of business, right? Or that advances a key quality metric that we're motivated to focus on in a collaboration with a care team or a group of clinicians. And so I think, from my perspective, it oftentimes requires that you go deep, roll up your sleeves, get on the virtual whiteboard these days. I miss the whiteboard, by the way. I don't know about you guys, but getting in the room and being able to chart a course towards a better future on a whiteboard I sorely miss that. So, but doing that activity and just kind of rolling up your sleeves with professionals in the industry and saying, like, look, what are the dynamics of how your goals are set, and how are you planning on tackling them? And because we just want to help. We're here to help, and we can't help with everything that you've got in front of you, but we absolutely know that we can help with a handful of things. And for those handful of things, I guarantee you there's a Venn diagram where doing the right thing and doing the things that moves forward an organizational goal, or advances a business metric, or makes the bottom line look bigger, or the top line better, or makes the top line look bigger. I guarantee you there is a Venn diagram of overlap there, and let's focus on that overlap as the first place to start. And let's not let the enormity of the overarching problems here stop us from making incremental progress, because before you know it, the incremental progress we make today is going to solve that big problem of tomorrow. We just need to start tackling it right away. So I think it's really all about that. It's just rolling up your sleeves, getting on the same side of the table as everybody else who's trying to move this ball forward. And fortunately, I think we're seeing good macro improvements in terms of kind of picking value-based care back up a little bit. I mean, I think it goes through accelerations and then maybe decelerations. And I think if I'm reading the tea leaves correctly, and you guys are probably in just as good a position to comment on that as I am, but I think we see a lot of positive signs towards improvement of an environment that allows us to do more aligned work, aligning more of the good activities with the benefits of doing that, like better reimbursement, avoidance of risk, better performance in contracts, value-based contracts or performance-based contracts, better thinking and alignment around accepting risk for the whole health of a patient. And when all those stars are aligning, you can't help but bring it all the way back to, okay, all of a sudden now, it's really, really important that we're partnering with patients to optimize their care, because really the whole process is sunk. If you're not investing time and money and effort in helping that patient be the most optimized participant in the care equation as possible, this whole thing's going to fail. So we definitely got to make sure we're doing that, if nothing else.
Right.
Yeah, I think one of the strange things is that it unfortunately sometimes takes a crisis in healthcare for the system to try new things, to adopt new ways of doing things, and then realize, hey, actually this can work in the system. We just needed a crisis to be kind of motivated to try these new things out. So I think one of the things that Al and I have looked to is, as awful as the pandemic has been, I mean, trying to be positive, the silver lining is that it's brought, the digitization of healthcare forward, 10 plus years, engagement forward. So at least going forward, things should be better from a, patient care engagement point of view. So we're hopeful about how that's accelerated. And that's one positive we can take away from all this.
Totally agree.
Yeah. So Jason, just being mindful of the clock, I did want to ask just one last question from you. In terms of where patient engagement is moving, I'm curious your thoughts in terms of what's most exciting today and maybe what you figure could happen in the next 3 to 5 years.
Yeah, I mean, I think it's, Josh, building on what you just said, I mean, I think not only as an industry are we embracing more quickly things that were, they were just moving at a different pace. Now, all of a sudden, we're doubling, quadrupling the pace in a lot of areas that needed advancement. And I think another key aspect of that is removing friction points. I mean, I think we can all agree that as we're all trying to do our best to move the agenda forward across healthcare as a system, where we run into friction points that slow us down, and you're always kind of annoyed. You're like, what is that thing? What's this thing slowing me down from doing this awesome work? And I think, the environment has created an open-mindedness to removing friction spots as well. So I think that's another type of advancement that we're all going to benefit from. So I think 3 to 5 years is seeing a dramatic improvement and acceleration towards. It's not about making sure that resources are available for somebody to access. It's about making sure that we're all basically enrolled in a health journey that is guided, personalized specifically to our needs, that is guiding us down the right path, completely in sync with our care team and the clinical plan of care. I mean, the next 3 to 5 years is going to see us make tremendous progress along those lines, to the place where this whole concept that we have even today of like, hey, we're getting really low engagement rates out on our website, not many people are visiting our patient education library. We're going to go look back on this and go, who expected to put an Encyclopedia Britannica out on a web portal, and that's going to drive a bunch of, like, it's going to be thousands and thousands of people flocking to try and spend time on that every day when they've got all these other things to do. We're going to look back on that, and we already are, right? We're already looking back on that and going like, that's ridiculous. Like, if it's not about me in my own personal health journey, I don't want to hear about it. If it's not about my family and their health journey, like I'm just not interested. Like if I want to watch a fiction, which is anything that's not about me is a fiction. If I want to watch fiction, Netflix is doing a really good job producing a ton of content. So I can go check that out. It's way more entertaining than just navigating through things that don't pertain to my health specifically. So to me, it's all about, hitting the accelerator. I know you guys are focused on this. We're focused on it as well, and want to continue doing that work together. But it's all about hitting the accelerator on making healthcare really a personal journey down to the end of one.
That's awesome, Jason. I think that's a great way to wrap up the discussion today. And I think I agree with you. Healthcare is only going to get more personal, and we're going to get much, much better at it.
So Jason, Fast 5 is basically 5 quick questions where our audience can get to know you a little bit better. The first question that we have is, what is your favorite book or book you've gifted the most?
What's the book by Simon Sinek that kind of kicked things off? Start with Why.
Oh, yeah.
So one of those things that I just love. Number one, his approach, fantastic. It's always optimistic. But I love the Golden Circle. I loved his TED Talk. It was super, at the time, revolutionary for me to kind of for him to put into words how I thought the world really works and do it in such a concise way. It was one of those kind of like synchronicity moments, and I think it was for a lot of people. It's why it's so popular. But so Start with Why, a great book. It's one of those that I've given out to a lot of people. And then there's another author. I won't sanction the whole, everything that this person's written, but there's an author, and poet, Paulo Coelho. He has this great quote that is constantly at the forefront of my thinking going into any situation, which is, the world is not changed by your opinion, it's changed by your example. And I can't even remember it. I don't know if he said that in The Alchemist or if he said it in some other writing that he had or something like that. But it's one of those off-quoted things. And when somebody is struggling, whether they're struggling or celebrating, it's one of those things I'll quickly type out and send on with a couple of thoughts that say, hey, hang in there, or hey, you're making this statement come true. Great work. Or, it's just one of those constantly inspirational sources for me.
That's awesome. Question 2 is, what is your favorite movie or TV show, or recent binge-worthy show that you've watched?
Yeah, you guys you're gonna think differently about me now, but I swear this show Schitt's Creek.
That's awesome.
That was kind of a sleeper. It was kind of a hidden gem. And I have to admit, it was hidden from me for a long time because we're not like huge TV watchers, and we seldom binge, but when we do, we're all in. It's like one of those. And I just like the way that the characters were built over time, and just the authenticity of the feel. It just didn't feel scripted. It felt like literally, you could plop any one of us down inside this show, and this is like just what real life. Yeah. And at the same time, they also were very optimistic and kind of like very, open-minded, and all of those things that we all want to be. I felt were on display at any given time, and it was just like refreshing to watch something like that. And it was that's kind of our guilty pleasure.
Awesome. Question 3, would you rather have super strength, super speed, or the ability to read someone's mind?
Super speed. Brute force is not my nature. And seeing inside people's minds is not fun. So, but I do love to get stuff done. I love to go fast. And so I like to talk fast. I like to move fast. I like to pack a lot in a given day. So super speed just means I can do more of all the stuff I love to do. And I don't want to invade somebody else's thinking. So I'd rather, in fact, it's more fun to get to know somebody in the way that they are willing to get to know me than to kind of know what's inside their minds. That's just me. Sorry to go deep, but that's my preference.
Great.
That's great. Yeah. Question 4, and this one might be a thinker. It's up to you. But what is something in healthcare you believe that others might find insane?
I don't know if it's contrarian, but if we had to pay for healthcare as consumers directly, and we had to plan for it, just like we have to plan for home improvements on our house, or hey, the furnace went out. Did we put money away in the rainy day fund to tackle that? Like if literally the mechanism that separates health consumers from the reality of the cost equation in healthcare, if that were removed and healthcare consumers had to react with the healthcare system directly as direct consumers, direct to consumer it's not radical, but to me, I would embrace that. Like I as a consumer, I want the control. I want to know, I want to have all the data, and just think of the ecosystem, think how differently our experience would be as creatives in the space of digital health if the solution was aimed at supporting the consumer in an equation where they're on the hook and personally accountable. And obviously you always want to protect the outliers, and anytime you get 1 or 2 standard deviations from the mean underneath that bell curve, you want to have safety nets in place. And I'm not arguing that people should be faced with harsh realities, but I think if we dramatically improved that direct accountability and direct responsibility equation, I think we would see immense positive changes for the public good as well as personal good at every level in the industry.
Awesome. And last question, Jason, it's a COVID-19 related question. What is one hobby or activity you've gotten into since the beginning of the pandemic?
Good question.
I mean, probably guitars, but
yeah.
I was just going to say, sadly, the opposite is true. Like you would think that I'd have a lot more time to spend on guitars. You know what I've probably picked up the most is photography and videography. This is, my wife's a professional photographer. She's immensely talented, and so I've been a fan, for a long time, and I almost feel like I'm the camera guy. Like I carry all the equipment around, and like so it's like I kind of like learned as like a side character in this equation. But I really have enjoyed taking a moment or two and kind of capturing little moments that are going on. And I don't know why. I don't even know how we've been able to carve out time to do it, but there's some level of introspection, and it's kind of fidgety, and you can kind of get lost in it a little bit, and it kind of helps you kind of hit the reset button. So probably those.
That's awesome.
So Jason, thank you so much for taking the time today. I think I learned a lot. I know Alan had as well, and I'm sure the listeners are going to get a lot out of this too. So thank you for sharing all that insight with us.
Great. Appreciate it, Josh. Thanks, Alan.
And we're super excited to see what the new advancements at Wolters Kluwer is going to be as well. I know there's a ton of other exciting things that you probably couldn't share with us today, but I think everybody in our audience, we're all excited about the future. And I agree with exactly the points that Josh and yourself, Jason, that you mentioned around personalization, N of 1, and reaching the patient where they're at with engaging material. So thanks so much for coming on the show today.
Absolutely. Appreciate it. Thanks for the time. Great to chat with you.